panel. Yeah.
It's diverse.
That's
and
even before we unmute. They're calling us an amazing panel. You go. That's a good perception.
Yeah. Am I audible and unmute yourself are the two most frequently heard phrases of 2020 and 2021.
Just start in 30 seconds. People are trickling in. Thank you, Geeta. And with that, I think we can start. Iman?
That's my best friend I just told you about.
Yes.
Who has joined. Yay.
All right. Welcome, everybody, and welcoming the audience as they continue to join us in this important conversation. Just want to start by saying a very good afternoon, good morning. I know people are joining us from across the globe. Dr. Usha herself is in a 5 a.m. time zone right now. So just welcoming everybody. This is the second part of the conversation of Unmute Yourself. And Dr. Usha just spoke about how unmute is one of the words we've been probably hearing the most in the last 1.5 years. Our purpose here at the Endeavors today is to use the Unmute Yourself panels and opportunities to talk about issues, have this open platform about tough challenges and talk openly about them, raise awareness about issues and ensure actions are taken. With that, I'm going to turn the panel over to Dr. Usha to just say a few words before I introduce our esteemed panelists, and then we go straight into the discussion. Dr. Usha, over to you.
Thank you, Sukriti, and welcome to everyone who has joined us. In addition to what Sukriti has just said, I think it's imperative that we highlight the fact that women are bearing the brunt of social, economic, mental well-being and mental health and other consequences of COVID-19. And on top of that, women's life cycle poses very unique challenges when it comes to pregnancy, women who are pregnant, who have been new moms, women who are planning a pregnancy. There are 300 plus million women in India who are in the reproductive age group. So, this is a really a time that's filled with, fear and anxiety for them. So they have lots of questions on their mind, like, what will this do to my baby? Will I have a safe and healthy pregnancy? Can I breastfeed? Should I even become pregnant? And of course, that $1 million question, should I take the COVID-19 vaccine? So these are all, really important questions. And so during this conversation, we'll try and get answers to these really important questions, because we have an awesome panel. People coming in from all different areas, from the media, from the medical community, from the community. And so this is really important. And also we want to start a conversation actually about that women's voices need to be heard. They need to voice their stories. And for those who and we need to be a voice for those who have been silenced or who have been spoken over or not taken seriously. So I think these are really important things that we want to start a conversation about today. And as founder of Divas, where we are committed to improving the health and well-being of girls and women, all across the globe, actually, and particularly in India, through awareness, advocacy, and capacity building. And I think this Unmute Yourself program is a big step in that direction. And I'm really thrilled to have Sukriti partner with us on this. Thank you so much. I hand it back to Sukriti.
Thank you, Dr. Usha. The pleasure is all ours. I just want to take 5 minutes to introduce the audience to this fantastic panel. Dr. Nozair Sharier, welcome. Dr. Sharier is an obstetrician and a gynecologist with a long-standing commitment to the advocacy and promotion of women's reproductive rights. He has previously served as the past General Secretary of the Federation of Obstetrics and Gynecological Societies of India. Dr. Hema Divakar is the former president of FOXI and currently practices at Divakar Specialty Hospital, Bangalore. She is also a technical expert with the Institute of Public Health, a Government of India initiative. Dr. Virender Singh Chauhan is an Arturo Falashi Emeritus Scientist and the founder of ETI. He was the former chairman of University Grants Commission. Working in the fields of engineering and biotechnology, he is known for his contributions to the development of the recombinant vaccine for malaria. He was honored by the Government of India in 2012 with the Padma Shri. Ms. Ramya Kannan is the Tamil Nadu Chief of Bureau at The Hindu and holds 15 years of journalistic experience. She completed her post-graduation from the Asian College of Journalism. She has written extensively on issues of health in the country. During the COVID-19 pandemic, she raised awareness through her writing regarding the need for safety precautions in light of the rise of the variants between public health and global politics and India's preparation for the vaccine rollout. Ms. Priyali Sur, welcome, is a multimedia and broadcast journalist and international development professional. In 2018, Priyali founded the Azadi Project, a nonprofit organization that provides digital skills training and internships to refugee women at camps and shelters. Her work focuses on the inclusion of marginalized communities. She has reported extensively on social justice and gender issues in South Asia and Africa. In recent times, she has been running the campaign Open Vaccination for Pregnant Women in India after her experience as an 8-month-old pregnant woman. Dr. Indira Bihara is a public health expert and an expectant mother. She has received her MBBS degree from Sri Ramachandran Medical College in Chennai and master's degree in public health from Columbia University. Her work focuses mainly on areas such as tuberculosis, global health security, health innovation, and systems design, maintaining a keen interest in strategic affairs and international relations. Shruti Harihara Subramaniam, welcome, is a model, actor, scriptwriter, and director. Her documentary film, A Far Afternoon, on eminent painter Krishan Khanna, bagged the Rajat Kamal for the Best Art Cultural Film at the 63rd Indian National Film Awards, and also the Best Music for Non-Feature Film. She is the founder trustee of the Cinema Resource Center and a proud mother of a 20-month-old daughter. Welcoming all of you, and I'm going to turn the stage over to Dr. Usha, where we are going to talk about the focus area number 1, which is impact of COVID-19 on pregnancies. Dr. Usha, over to you.
Thank you, Sukriti. So for the first segment of our seminar, the webinar, the focus will be on understanding the impact of COVID-19 on pregnant women and lactating mothers. So the first question is to Professor Chauhan. And I must, before I ask the question, want to say what an honor it is to have you as a panelist. Thank you so much for being here. So in a recent interview, you mentioned that the battle between humans and the virus, it is a struggle for survival for both. And as of now, we don't have a clear winner. So keeping this in mind, how can we prepare for the future?
Sir, you're on mute.
Me now?
Yes, we can hear you.
Yeah, I can just, it can be a very long answer, but I think I'll make it as brief as possible so that we get back to the focused discussion. Their word out there, which is a result of evolution, there are a large number of species, and sometimes humans think that they have the right to be here more than any other species, then that's not true. And I think that's what this very tiny virus has taught us. So these struggles, this is what Darwin had said, this is survival of the fittest. But let's not get into that space. But I'll only say this to you, that no matter where the life is, whether life is essentially wherever their DNA is, whether it's plants or it is insects or it is viruses or bacteria, the job of each independent piece of DNA or the requirement of the DNA is to multiply. Some species cannot multiply their own, they require a host. And in this case, present case, viruses do not have a machinery and they require hosts, whether it is animal or it is a bacteria or it is human. So it happens to be human this time. And these viruses have been with us for as long as we've been with them. So this is not new. And I don't think this is the last pandemic or last viral break that we'll see regularly. Since 1970, we've been watching Zika, HIV, H1N1. They come with regularity. And there's another issue, why they're coming so often now. So I'll just leave that aside. This has obviously impacted. It's a new virus. I just want to give one very clear message that the virus being as new as it is, we are still learning about it. The science, you would say, is changing about this virus. So what we were saying yesterday or day before yesterday may broadly be true, but it might change. For example, mutants have arrived. Is this mutant more infected than the other mutant? If yes, how much more? What is happening? So things will change. The way we look at virus will change. So it's an evolving situation. When I said that the race is still on, the race is the virus just simply would like to get as many hosts as possible to multiply. And our job as human or humanity would be to make sure that it doesn't multiply as much as it wishes to. So that's where the vaccines are. And that's where we have social distancing, that's where we're masking. So this is the context in which I said, what impact has he had? This virus or this pandemic, as everybody has said, we haven't seen anything in the last 100 years. And though none of us were alive when Spanish flu came, maybe Spanish flu was much worse. But today we are equipped with so much more. So I don't want to take too much time. The moment virus was discovered, and by the way, we still do not know the origin of the virus clearly. On 11th of January, when the sequence was shared with everybody, within 3 months, we had the first vaccine in human arms. So we are much better equipped. Might I again remind ourselves we are better equipped, but see the havoc the virus has created. So I'll stop here, because I think our focus is going to be more on the virus and especially the women and pregnant women. If you have any other questions come up, how the vaccines are discovered, what are the vaccine, what is going future, what the future vaccine should be like, where will they be produced, I'll be happy to take those later on. So I just want to conserve the time right now so each one gets to say something. And if anybody has any issues about how they're produced, what are the platforms we are using, can there be better vaccine than what they are, what will future vaccine, I'll be happy to respond to that.
Thank you, Professor Chauhan, for sharing your insights and some of those questions that you said you'd be happy to answer. We are going to come back to you on that. What I'll do now is move to Dr. Noza Sharir. How do you think COVID-19 affects pregnant women and newborn children differently, and are they at greater risk?
So thank you so much, Usha. Wonderful panel and very privileged to be part of it. So I'm going to speak to you firstly based upon what our understanding is and how it has evolved over the last little more than a year. And I will also refer to my personal experience of looking after patients in this last 1 year. So I had my first COVID positive pregnancy 1 year ago in May 2020. And since then, in a private practice in Mumbai, I have last week had my 56th COVID positive pregnant patient that I looked after. Most of them did very well and were safe. Many of them had the infection during pregnancy. Most of them initially, at least in the first part of the pandemic, were pretty asymptomatic. And now maybe we've had more symptomatic patients. And then one day I lost a 29-year-old COVID positive pregnant mother. So it is, for me, a disease of extremes. Women need all the possible help and support, more so when they're in the very vulnerable time in pregnancy. I can tell you for the first 3 months of our lockdown, women froze, but soon people got their act together and pregnancy started, and India has 27 million pregnancies in the year. So we've had a lot of COVID positive pregnancies that we deal with. What do I tell my patients? Patients look to doctors for assurance. These are pregnant women who come to us. The first thing I tell them is there's no real scientific evidence that COVID causes significantly more miscarriage. Though I must say that there have been a few cases of mine where a miscarriage might have happened following a COVID infection. We can't be sure. I tell my patients that when it comes to being pregnant, you would have concerns about birth defects, as you would have with rubella and varicella. Doesn't seem to happen with COVID. And we've had a year of experience now, which is constantly building. Concerns about maternal child transmission. We know what HIV and hepatitis C and hepatitis B do. And I reassure them and tell them that yes, while there have been evidences of transmission, the risk is small, and probably we are looking at maybe somewhere around a 2 to 5% risk of maternal fetal transmission. So by and large, and I say this with a lot of care and concern to my patients, generally COVID has been kind to pregnant women. Remember, H1N1 took a large number of mothers' lives. A significant percentage of mortalities with H1N1 were pregnant women. But that's not how it's remained. And there are more and more experiences that we have, anecdotal and publications, which tell us that there have been consequences, perinatal consequences and maternal consequences. Perinatal consequences, yes, there has been an increased incidence of preterm birth, but there is definitely a possibility that some of this is iatrogenic. And this is something we obviously need to keep in mind. And I think the medical practitioner really has to keep calm and see how we can support the pregnancy as to go as forward as possible. Maternal, well, remember, we have pregnant women with all kinds of comorbidities, and we know what comorbidities do to people in general. So given that, like I said, for example, that patient of mine who went home well from the hospital and came back almost immediately, and with significant lung damage, and then went through 20 days of everything, including ECMO, and finally we lost her. So we can never, ever take this disease lightly. Other concerns of pregnancy and pregnant women, well, the first question we get asked is, should I be pregnant in this time? And that's a tough one. I think that's a decision that the woman makes with her caregiver and her family. But by and large, I think women have been brave enough and have braved through this pandemic. And I can tell you from personal experience what happened after the first 4 or 5 months. There is going to be a baby boom in the next 2 or 3 months. A lot of women kind of plucked up and went ahead and had pregnancies. And I'll share some other very interesting information with you. Couples who weren't having a pregnancy had women suddenly conceiving because people started doing what they're supposed to do. A lot of young professionals started having sex. And trust me, sometimes when you see the kind of lives they live, that was something that a lot of couples ask, should they wait? And some of them, out of their concerns, have terminated pregnancies, and we should support them on that if that's what they want. A lot of couples need a lot of support, because you can imagine pregnancy is a time of concern, and you can imagine what happens to mental health at this time. What happens to a woman who's not only restricted, and I remember a person I know had to do an article recently on women, and she made it very medical, and I said, no, leave the medical aside. Can you see what this woman is going through? Working women have had their lives disrupted like never before. She is leading multiple lives at the same time she's working, and at a time when she would have been away from home, she's working at home and for home. She's got children who are studying from home, which she's having to look after. This is putting tremendous pressure on women. And finally, of course, and I suppose this will come up with any of the other panelists, that when we think about women who are in difficult relationships and abusive situations, can you imagine the dread and the fear to be at home and not be able to access people in the outside world because communication has been disrupted? So pregnancy is impacted. I believe it's a kind of a spectrum. Most women will do well, and I think a majority of women in our country have done well. There have been women who've done very badly, and those women need to be recognized early and cared for and looked after in the best possible manner. We will again revisit this when we talk about vaccines, but please remember that pregnancy itself is a thrombogenic condition which puts women at high risk of thrombosis, and that's what this virus also does. And that's one special fear and concern we have, particularly when more and more of us who look after high-risk pregnancies look after women with thrombophilias and the like. So I think I'll stop here, and maybe when other panelists speak, and if something comes up, I'd like to share further my experiences.
Yeah, I just have one quick question for Dr. Sharir, which is in the women who had COVID in your practice, did they have comorbidities like obesity or gestational diabetes?
So the one young patient that I lost was a patient who has always struggled with obesity. So that definitely was a comorbidity. Some of the others did. But like I said, you know, when we have patients testing, many of our patients tested positive on routine checks. And we've been checking and testing, and sometimes we've been doing this, I'm sorry to say, like headless chickens. Hospitals insist on tests to let women in. We insist on tests to let women into the OT. And many of these were incidental diagnoses where we picked up someone who was positive. They never had a symptom, and they kind of came out of it after a few days. But I have seen a sea change between the first and the second waves, and the patients have seen recently, and I saw a crazy a spike in the last 1.5 months, the kind of cases I saw where I was sometimes having 2 and 3 phone calls a day. It suddenly seemed to have become more symptomatic, more fevers, more issues with oxygenation, and just like anyone else, you can never let your guard down. And I believe in a pregnancy, because of the fact that pregnancy itself, while it's technically not a comorbidity, but what COVID does with coagulation becomes a very high risk factor for the infection. So vigilance and early detection of problems and swing into action earlier on. And of course, I'm sure someone else will discuss the medical management.
Thank you so much. Sukriti?
Thank you, Dr. Rusha. Priyali, welcome. Just want to turn to you to understand, like Dr. Sherry is saying, pregnant women have had a tough time. And, in your experience, and that's an experience that many pregnant women have faced with literally nowhere to go. I just want to understand from you that, can you share your journey and the difficulties you faced while accessing healthcare?
Yeah, thanks, Sukriti, and happy to be here and discuss this. Dr. Sharir, thanks for sharing those numbers from your hospital in terms of the 56 patients, pregnant women patients that you've seen in the year. And, just as you were speaking, I was wondering, of those 56, how many have been in the second wave? And then you kind of answered my question and said that a lot of them have been in the last 1.5 months. So I think the first wave has impacted pregnant women differently in terms of COVID and the second wave. Before I come to my personal experience actually pushed me to do a report for the NPR as a journalist, looking for how the second wave had impacted pregnant women. And what I found, obviously very anecdotal because there's not enough data and statistics out there as yet, is that a lot of these women had been very symptomatic. A lot of them could not access hospital care. Sudden changes in their body in terms of loss of oxygen, the oximeter levels going up and down. Some of them needed ventilators. They were turned away from hospitals. The maternity hospitals would say, go to a COVID hospital. The COVID hospital would say, we cannot take in anybody who's pregnant. You need to go to a maternity hospital. Crucial time was lost, and a lot of them not only lost their babies, but also lost their own lives. So I think it's important to put that into perspective, that, why is it that I even started a petition saying that vaccination should be there for women. I think we discussed the risks of COVID on pregnant women, but we so much so did not discuss the risk of vaccination on pregnant women and which risk is higher and which risk is lower, right? So if the risk of COVID, or if COVID in the second wave is kind of more symptomatic, and for women who've not been able to access hospital, is leading to certain concerns and at times even very fatal results, then should there be an option available to these women that they can access vaccination? Having said so, I was fortunate enough to have very mild symptoms of COVID when I got COVID. But I had no respiratory symptoms. I did have very high fever. I had nausea, a lot of throwing up, a lot of gastric issues, and very concerned about what Dr. Shariar said in terms of the blood clots, because I know that pregnancy is a condition where you are susceptible to blood clots, and COVID again is a condition which is susceptible to blood clots. And I was in a place which was about 1.5 hours away from any general hospital. And even when I called the general hospital, one night I had 102 fever, and I was like, I know high fever is not good for the fetus. So, what can I do to control this? And what if there is a risk of blood clot? Because I was already imagining all kinds of swelling in my legs, because that's what you do when you're fearful and when you're anxious, you imagine all kinds of symptoms on your body. So I was like, oh my God, I have swelling here in my legs. Is it swelling on both my legs? Is it swelling on one leg? Is this a sign of blood clot? Can I get admitted to a hospital which can put me under constant supervision in case there's an emergency? Because I knew if there was an emergency, I probably would not make it on time because the hospital was really far away. And so when I called the hospital, they immediately said, we cannot take you in. I thankfully recovered, but I think that kind of pushed me to see that what was happening. Having said all of that, what I'm trying to say is that, is it worth it having pregnant women always live in this fear and anxiety that what if we get it? And, we have no immunity. We are not protected. In fact, probably the only population above 18 years above in our country who do not have the option or choice of going out and saying, listen, I'm okay with getting the vaccination, vaccinate me, and taking that chance on my own. Or do I have to take a risk and take a chance of getting COVID every day? Because I may be privileged to live in my pregnancy bubble, make sure that nobody enters my house, make sure that when I go to the hospital, I'm like doubly masked with a face shield. But a lot of pregnant women are not that privileged. In fact, most pregnant women are not that privileged. So should we not leave the option with these women? That's basically my
Thank you. So, Dr. Rusha, talking about what Priyali is saying, options and choices, I'm going to turn this back to you for the next question. You're on mute.
Yeah, thank you. And my question is to Shruti, who's a new mom, a relatively new mom, and being a mother is, itself a challenge. And in these COVID-19 days, it could be, much bigger challenge as we have seen what's going on, worldwide, especially for working mothers. So just want to talk to Shruti and find out what has been, the special challenges, or what's been your experience with this whole COVID-19 and lockdown, and what's happening to moms. Shruti?
Thank you, Dr. Usha. And I'm very honored to be one among such wonderful people. And I must also thank the whole doctor community for what all of you are doing selflessly. I think I just can't imagine the community and your support staff, whatever you're doing during these testing times. My experience, my daughter was about 8 months old when the first lockdown happened. And yes, we are definitely far more privileged than most others. And but like most Indian working moms, I had all these plans set when I became a mother about how am I going to manage work and the baby and many such things. And but the first thing when the lockdown hits you is the fact that you don't have the kind of access to the support system that you usually have as a working woman. I'm not just talking about in terms of the help at home, but even the extended support, even just stepping out with your infant for a little walk, or or as the infant grows up to be a toddler, the little experiences the toddler is going to face, or spending time with family. Those are the things that first hit me. But in some ways, I was fortunate. Maybe it was because I had this crazy lifestyle. Both my husband and I, we were traveling a lot, and we were preparing to go back into that life after the baby was born. The first 3 months, we both slowed down. But I guess this was a good way for us to be far more hands-on with the child that we ever expected we would do. So for many of us, it was actually a blessing in disguise. You could also say in some ways, however tiring and stressful it was to manage things at home and at work, there was still a little bit of hope every time you saw the child at home. So those were some little blessings that we were thankful for. But the thing is, especially for a young infant or toddler, the experiences that the child has in terms of interaction with other people or even the environment is what's going to make them the kind of adults they're going to be. And I had even planned out of sending my child when she's old enough for toddler play school and Montessori learning to teach her those life skills and to learn to interact with other children her age. But all those plans crumbled. And as it is, nobody prepares you for, I mean, how much ever you read about being a mother, or you take advice, or, you take up all these classes, you're never prepared to be a mother. When it finally hits you, you always think you're not prepared enough. And when the pandemic hits you, that's another kind of, it really throws you off. And when motherhood and pandemic comes together, there is no reference point about how is this going to affect my child? I mean, is it developmentally going to affect my child just being within these four walls in a crowded city? So those were, as it is, moms go through guilts, and we try hard not to feel guilty. But to realize a lot of your child's now development or her understanding of the world is now in mostly your hands, it sort of puts an extra pressure on you besides every other pressure that you're undergoing. again, thankfully, somehow mothers have this thing. Even though I was a late mother, I thought none of my, all my peer group, most of my friends have had babies much earlier. I was wondering, I'm going to be doing this alone. Somehow, the minute you become a mother, you land up having a little new sort of a peer group, new mothers as old, with children as old as yours. So that little support system kind of helps to talk to each other, that safe space to discuss, oh my God, I'm feeling like this today. Is it okay? I mean, and when the other mother says, I too am feeling the same, there is a little comfort in that. And it does change the way we work, for sure. And with working from home and having a child at home, however much you're going to lock yourself in a room and work, you can hear the child cry. You can hear the child scream. And how much can you cut yourself off from that? I have been in actually talks like these, when I was still feeding my child, for over 20 minutes, I could hear her scream in the other room. And finally, I had to excuse myself from the talk and go and feed my child. I have, again, participated in many meetings and other things. Thankfully, there is you can shut your video off and maybe even audio if necessary, because I was feeding the child as I was taking those meetings or giving those talks. So it kind of really changes the way we work. And it also changes the way we even bring up our children. So if I am unable to send my child to play school, or she is unable to have the experiences that a normal one-year-old would experience, I had to push myself to read up more on how creative I can get to give her those kind of experiences within the four walls. If it means like getting a crate and filling it with some sand, give her the sensory experience. We kind of became lenient on our no screen time policy with the child. We allowed her to video call with grandparents and friends so that she doesn't lose touch, or she understands what family is. So it's a bit of being flexible, and at the same time, yes, it's a lot of hard work. And we were thankful to have a support staff at home who was living in. So it was much better than most others who had to like bring up a child and manage work. For me, the other toughest part happened recently when I had symptoms of COVID-19 and I had to isolate myself. Even though I was not tested positive, I was exposed to someone who tested positive, and just to be safe, I had to isolate myself for 2 weeks. It was difficult for all of us, but I was still better off because I know of friends who've gone through more severe symptoms. There were people I know who was still feeding mothers who were hospitalized, and they had to pump the milk every day from the hospital and send it to their child. And the child was still, couldn't understand or make out why the mother is not with them. Or I have friends who have taken care of toddlers, and they didn't have it was just the husband and wife, and she just couldn't afford to isolate herself. And she had to take care of the child wearing the mask and hoping everybody else at home would be safe as well. So for me, thankfully, I was able to see what my daughter was up to through a window. I had to talk her through, even though she was a toddler, I had to make her understand that Amma is not well, so I can't come be with you. I didn't give her false promises. I didn't say I will come tomorrow or the day after. I had to keep the dialogue going, make her understand. And surprisingly, she was very accommodative, and never once she knocked on the door in those 2 weeks. When on other days, even if I have to go to the bathroom, she would be knocking on the door. So, and when we were almost ready to come out, I continued the conversation saying, Amma is going to come out now. What do you want to do with her? Would you like to read a book? Amma would like to hug you. Are you ready for that? So those dialogue kind of helped her even understand. So I think we should also look at what are children thinking, what are toddlers and children going through during these times.
Shruti, sorry to interrupt. We'll come back to you in the next segment. Okay. Yeah.
Thank you, Shruti, and we'll be back with the second question that we've been talking about. Just to close us out on this focus area, Dr. Hema, I'm turning to you. Just bringing the conversation back to COVID and the rise in deaths and miscarriages amongst pregnant women in the second wave of the pandemic, especially. What is the expected impact on maternal and child mortality for India?
Thank you, Sukriti. And if with Usha's permission, I may say that I must offer a huge congratulations for the entire title of Unmute. And you said unmute and can you hear me is oftentimes heard. And even before Professor spoke, there was a repeat performance on this program as well, the same buzz going up. And again, it reflects on the thought process that many important voices of many women out there, they are talking, but they're not being heard. So thank you for bringing us together consistently, constantly, and in a chorus, we need to say what we need to say. So in the COVID era, the girls and women, the entire healthcare system has been under tremendous pressure and therefore already a silent epidemic which was on in our country with respect to the care for girls and women, as in the accessibility, the affordability, and the awareness. It is already well known that for decades, we couldn't prevent the preventable deaths. We should have done better. Constantly, we are at it and we are doing better. But this has again highlighted a further impact. Roger is here and he knows that there was a huge unmet need for contraception, for example. The recent report from the Foundation of Reproductive Health Services, they said another 23 million women are lacking the access to contraception, which means that another 2 to 3 million women have unintended pregnancies. And what do we do with the unintended pregnancies? Half of them will reluctantly continue, and the other half will go in for abortion. Again, the constraint of access and unsafe abortion and all of that, which is then hugely magnified in this COVID pandemic. Those who do continue the pregnancy, intended or unintended, have a huge constraint, as Briali said, even in the best of the circumstances to reach the doctors. So those who already had limited access, can you just imagine their plight of how much more enhanced this would have been? But there is a silver lining, because the teleconsult and the WhatsApp calls, now we are all more ready and geared up to receive their calls and reassure them and give them a wise advice or two from very many interior places spanning. We do get the calls and the helplines are buzzing with activities, etc. So there is more happening, even though who were pregnant were asked to go to the hospital only for a limited number of times. That itself again creates an anxiety in them, because they are used to month after month going and visiting their doctors, reassuring themselves that all is well and this is not happening. The touch and feel and the direct contact is lacking. So the escalation of the anxiety and uncertainty is way too much in this pandemic. And as Nozer said, in the first wave, we thought it was all a short-term thing, so people were trying to postpone the pregnancy, but then they know that this is not going away. So how long can they postpone? And then finally they came in and they're all getting to be pregnant, knowing fully well that they have to cope with these uncertainties. And some of the neglected problems for women, as in the mental health conditions, as well as the domestic violence, they have now come into the forefront. Even we as OBGYNs have started paying a little more attention to all of these issues, and it's as if the COVID has given us a renewed opportunity to revisit these situations, which were anyhow existence, if not, not coming to the forefront, they were always in the background, but they were there. So in terms of everything inclusive of the supply chain and the human resource, as we speak, Shruti said about the new moms. See, the capacity building, if the innate nature of a woman is, mothering, and even for that, they, the mindset is that we need somebody to help us. Just imagine the healthcare professionals who have to deal with this whole new situation, and also diverting the healthcare professionals only to COVID and COVID and COVID duties. We are, first of all, so short-staffed, and then more of them are being deputed elsewhere, and they have to cope. And we as OBGYNs clearly said they didn't take into the maternity home because they're just not geared up to look after pregnancy, yes, but COVID with pregnancy, maybe, may not be. So they are, as medical professionals, I don't think we have ever lived in a phase of such uncertainty, and therefore the confidence levels in telling the patients what we normally tell them in a reassuring way, that has impacted our own minds as well. Maybe, may not be this and that. So every time, every minute, things are changing. So it has been a challenge for the medical professionals and healthcare providers as much as it has been for the girls and women of our country. That's what the present scenario is.
Thank you. Thank you so much. And completely noted, it's been an equal challenge for everybody. We just talk of one challenge more than the other. So I'm glad that we are addressing this today. Before we move to the second conversation focus area, I just want the audience to also engage. I'm just going to take 30 seconds. There's a question which is going to pop up on your screens. If you can take a few seconds to answer that, it's a poll question which is going to make you think. So what do you believe are the factors which might put pregnant women at greater risk when it comes to COVID-19? Please take a few seconds to vote, and we can just talk about this and move to the second conversation point. And my team will shortly pull the answers up. And while we do that, I just want to introduce the second conversation topic, which is global evidence and existing guidelines to COVID vaccination. A very critical next point that we need to address, because there's been so much talk about vaccines, the lack of it, the access, the choice, who should we ask, etc. Can the team please put up the results for the question? So most of us think that one of the major factors which might put pregnant women at greater risk when it comes to COVID-19 is insufficient resources for COVID healthcare. Keeping that in mind, I'm going to move on to the next conversation set. And for this one, I'm going to start with Priyali. Priyali, you know, as I introduce this, there are some slides which are going to come up on the screen, and I hope the audience as well as the panelists can see them. Priyali, as she mentioned, has just started a change.org campaign on open vaccinations for pregnant women in India. And she just shared with us her story. And on your screen, you can see some slides where she started the campaign, which has reached about more than 45,000 people. And you can see how people have left comments. They are sharing their stories. There are parents, there are sisters, brothers coming out, sharing that concern, which makes us understand right there, my daughter is pregnant. And there are so many people who want these answers. And to Priyali, my question is, what is your message to the policymakers and young women and mothers-to-be of India?
Sukriti, thanks for sharing those slides. In fact, those comments actually, I go through those comments every other day and feel more empowered to do this, because there are so many out there who actually are wanting to feel safer and more secure. So my message to the policymakers, and you're saying message to the women separately?
Yes.
So
can't be the same.
No, I think I'll start with the women first. I think we are intuitively, as women, very intelligent about our own bodies. And I don't have to give a message to them. They know what is right for them. They know what they should do. If they feel unsafe in their surroundings for whatever reason, they should look for those safety measures. And if that is a vaccination, then sign the petition, go ask for the vaccination. It is our right. It is our right to choose what we want and what we don't. It is our right to refuse the vaccination, but open it up. So I don't want to give a message to the women, because I feel as a woman myself, I think we intuitively are intelligent about what we want, about what our bodies need, and we should just listen to that intuition. In terms of the policymakers, I'm actually rather shocked that we have not been considered at all in this vaccination policy, that this has excluded us from the entire aspect of even being considered for a vaccination, knowing that we are susceptible and at high risk of mortality or at high risk of severe complications if we do get COVID-19, as international studies says. I'm not a medical expert, so I'm not saying this. I'm just quoting from the medical research or the studies that I have seen as a journalist. I know the question is about AstraZeneca, which is Covishield. Is that safe to give to pregnant women? But that is a vaccine which is also being given in the UK. And if I can see the JCVI, which is a Joint Commission for Vaccinations and Immunizations, has actually said that pregnant women in the UK can be given Pfizer, Moderna, and AstraZeneca. So my appeal to the policymakers, my appeal to the government, my appeal to the Health Ministry and the ICMR, which is majoritized by men sitting out there, is that open it up to us. Open up the vaccinations to us. You are not making the vaccinations compulsory for pregnant women. You are giving us the choice to decide if we want to go and take that decision to get the vaccination. And your awareness campaign should focus exactly on this. These are the risks, these are the benefits, and let the woman decide what she wants to do. So that's what I want to say.
Thank you. And I know you have to leave us at 5 o'clock, but to the audience, if you have any questions, there's a Q&A. I can see some questions coming in, but Priyali, thank you so much. And as a fellow change maker, past experience person, all the very best. We are standing with you, and best of luck. And thank you for being with us.
Thank you so much. It was an honor to be on this panel. Thank you.
Thank you, Priyali. Dr. Usha, I'm going to turn to you to take us forward, please.
Sure. Thank you. And thank you, Priyali, again. I'm sure your comments are going to generate a ton of questions, which I hope Dr. Nozer and Hema can help us answer some of those questions, because this whole COVID-19 is relatively new, and we're just, learning. And there's, constantly have to balance this, what we know and safety versus, rights of women. So it's a tough, tough line that we are walking right now. So we'll come back to that in a minute. And so we're talking about global evidence and what is, try to understand the current evidence and what the current guidelines are, and what are the Indian, both the government and the professional societies, their stand on this. So I'll go to our in-house expert, Dr. Shariar, on this. Could you elaborate on the guidelines provided by the Ministry of Health and Family Welfare? And of course, what does the medical community, we heard from someone who is pregnant, but what does the medical community think about vaccination?
Usha, the pandemic has made us do many things, and not many of those things are evidence-based. We made a series of alterations in course when we realized what the consequences of a treatment we started with this disease are. And my concern is that we should not get it wrong when it comes to the very sensitive, special, precious time that is pregnancy. We've always considered pregnancy to be a condition which has to have a much higher level of evidence and safety and standards before we make a decision to put something on pregnant women. And I completely get what Priyali said, and I completely understand the concerns. I'm concerned, I'm afraid, but that should not have me make any errors that might harm my patient. Now we have two things here. We are thinking at a macro level, but we have to think at a micro level at the same time. Policymakers and governments sometimes think at a macro level and push something through for the greater good. But when I am the one looking after that one woman who has a consequence or a complication, I am responsible for that individual and her. Anyone who knows me knows how strong I am when it comes to women's choice. Anyone who knows me knows how I will support anything a woman wants to do. But there are certain things that have to be based on evidence, and it is not acceptable for me to push a responsibility that is my responsibility onto a woman, saying, you decide, you make up your mind. It is probably safe. It may not have any side effects. We will know with time, but the benefits outweigh the risks because the consequences for that individual at the micro level are serious. I get what the government has said, and our government at the moment has said no for pregnancy. The two manufacturers in our country have very clearly put this as a contraindication. In fact, I'm also surprised that with very little evidence, the government has suddenly opened it up for lactating women without telling us how soon they can, how much time after pregnancy, which vaccine. When you make a recommendation, recommendations have to be nuanced. Now, I hear this quote about the US and the UK and Belgium and Israel, and I completely understand that. Why aren't we demanding a vaccine which is recommended for those women in those countries rather than compromising for women in India? Do you know that the JCVI, which keeps getting quoted, has recommended that people between the ages of 30 to 39 should preferably receive an mRNA vaccine? That's their recommendation. Most of my patients are below the age of 39. That they've reported that while the risk is small, there definitely is a thrombogenic risk, and we know that certain countries have actually reported and had complications. And do we understand that a pregnant woman is at maybe 4 times the thrombogenic risk of general population? I don't think we know enough about the second vaccine, the Covaxin, and I'm quite interested in knowing what that would do. But shouldn't our ask be fast track scientific evidence, bring in a better vaccine in the shortest possible time, have specialized vaccination centers, even if you can't vaccinate large swathes of population, at least do it for those 27 million women in a year to start with. That we can definitely access. And I'm sure that's a better and a more scientific way of doing it. Now, when I look at other things as well, and I understand this eagerness, but now let me think about it from the point of view of my patient. In an article, Dr. Zari Rudwadia said that a lot of people caught infections after their first vaccine, and vaccines were falsely blamed for that. Has anyone really realized the kind of situations in which people go to get vaccinated at many of the vaccine centers? And now in many of them that I have seen, there hasn't been great physical distancing, and you're sending a pregnant woman out of her bubble into that space. Have we all not seen even just generalized side effects and reactions, which may be transient for 2 or 3 days? And I've had some friends and colleagues who had pretty violent reactions. Do I want that to happen to my pregnancy? First trimester, so you start in the second trimester. Today they are pushing the second dose after 84 days. She spends most of her pregnancy So I think we need to give it more of a thought. I think people like Dr. Chavan maybe need to come out. I think virologists and epidemiologists need to come out. I think the government needs to be pushed and asked, why isn't an mRNA vaccine already in our country? Because there is an evidence of 90,000 women documented in the US and maybe many more, that the UK has actually said, and the UK is very clearly in its, I will tell you what, because people keep quoting the RCOG, and they have said based on the data, JCVI advises it's preferable for pregnant women to be offered the Pfizer or the Moderna vaccine where available. When did we doctors become lawyers? When did we start using language like where available, probably safe? And at the end of it, even for a lactating woman, they go ahead and say that the woman should be informed that there is no evidence on safety. What right do we have to shift responsibility? So I think at this point in time, my message to my patients is, hold your horses. Let's wait for something better, and I'm sure it will come. Stay in your bubble in the interim. Vaccinate everyone in your life so that everyone in your bubble is safer for you. be safe, be careful, because even after the vaccine, you're not going to let your guard down even for a single moment or a day. Continue and stress upon them how they can be safe. And I think till better scientific evidence comes, I will wait. Lactation, yes, my pediatrician colleagues are pushing women. Let's at least identify how much time it takes for a woman to lose the thrombogenic risk. Let's tell her when she can step out. Is it 3 months? Is it 6 months? Give me a recommendation. Which of the two vaccines should be used, or should we wait for another one? And I expect the recommendation from the ministry to be nuanced and not a blanket registration saying all lactating women should be vaccinated. So, I mean, a lot of it is guidelines, but some of it is my personal opinion. I'm willing to discuss it with the other panelists.
Thank you so much. I think we needed that clear-eyed, mature approach. It's a very nuanced area, and thank you so much for your insight. So, Kriti?
So I could see Dr. Indira Bihara nodding in agreement. I'm going to turn to her, and as a public health expert and an expectant mother, Indira, what's your perspective on the value of vaccination after what Dr. Sherrier has spoken to us about?
Thank you, Sukriti, and thank you everybody else for having me on this panel and your valuable opinions as well. I think, Sukriti, let me just comment, and I'll try and be quick about this, even though I have reams to say. Vaccines in general, as a concept, vaccines work, okay, they save lives. There's no doubt about it. And I have told everybody I knew, okay, whatever vaccine comes into the market, whenever it comes against COVID, take it. Your chances of, your chances of hospitalization, of severe illness, of death go down to nearly zero from everything that we've seen. I understand there are exceptions, but it has gone down. They go down tremendously, right? Vaccines have seen, okay, they have contributed to infant mortality decreasing in India, better outcomes in pregnancy and so on. But when it comes to the COVID vaccine, I have to agree with what Dr. Sherrier is saying. I am now in my third trimester. I am 32, well, a little more than 32 weeks in. And when I was at 27 weeks, everyone in my family got COVID. It started with my 22-month-old at the time. We couldn't figure it out. And then, of course, everyone was sick. And suddenly we realized we're all symptomatic. We have high fevers. We have coughs. We had, elderly diabetic folks at home. I mean, so it was quite a nightmare. Okay. And frankly, I would have really liked at that point in time, okay, or maybe a few months before that, if I had had access to vaccines that for, at least in other parts of the world, were being administered to pregnant women. And we know that the Pfizer and the Moderna vaccines, for a few months now have been studied. They have been enrolling pregnant women. They were studied. And generally, like Dr. Sherrier was saying, mRNA vaccines are vaccines of preference for, the age group that also coincides with reproductive age group as well. So I would have really liked to see, I would have liked to have that kind of choice to be actually able to go out there and choose that I want to get vaccinated. And now, after that, what I started hearing was that there were, off cases of providers also recommending, the vaccines that we currently have. And while that's, I understand where that they're coming from, of course, but I would have also liked to see a little more, at least on the, the policy level, a little more clarity and thought, rather than just WhatsApp messages circulating around about why and which vaccines pregnant women should get. Because I looked it up unto death, a medical professional myself. I read the WHO guidelines as much time as they might take to come out with them. I read the guidelines from the manufacturers and the groups that had actually studied these vaccines. And at least from what they were saying, they were not actually actively recommending those vaccines that are available over here to, my cohort of people. So it would have been nice to have a little more clarity on the kind of information that was coming out. There is no doubt about that. I would like, and I'm not sure, where the delays are coming from, but even at this point in time, what I would really like to see is an accelerated rollout to a lot of the other vaccine candidates that are available globally. I understand, manufacturing delays and supply chain issues notwithstanding, at least from a policy perspective, we should be trying our level best to get the best care that we have to a relatively sizable population that is at a higher risk. And I think furthermore, if I could add to this, I think it would also help for all practitioners, whether they are in the OBGYN space or in pulmonology, to be a little more coordinated about what kind of treatment and management they can offer to their pregnant patients. I was lucky that I knew and had interned with one of the foremost pulmonologists in our country, who was able to therefore give me time in a matter of hours and take me through the risks I was at, as well as a sensible kind of management. But I also am aware of the other kind of from being recommended oseltamivir or Tamiflu, which has really very little bearing in this, to 100 other things. I have to say, we really have to be, and I'd like to see the medical community also being on the same page as guidelines and evidence as far as they can manage. So,
thank you, Indira. And with that call to action, I'm going to turn back to Dr. Usha.
Yeah, and we go back to Professor Chauhan. So this is about vaccination in general. How is India doing compared to the rest of the world? And sort of how does one determine the safety of vaccination during pregnancy? Professor Chauhan?
Sir, you're on mute. Yes,
okay,
we can hear you.
I heard last speaker, let me just quickly put vaccine development against COVID-19, or for that matter, any vaccine when it comes for human use, into a little bit perspective. The vaccines, as all of you know, and I'm not going to repeat, have come out faster than any other time any vaccines had come for any disease. Not one, we have 12 vaccines which are now approved in different parts of the world. Western world has depended largely on 4 vaccines, and the rest of the world is happily immunizing. There are more than 550 million people have been vaccinated in China, not one of them with Moderna or Pfizer. So this needs to be put in perspective. Discussions or regulations or anything that happens, as a scientist, I'd say has to be data-driven. Since we do not have any data, therefore we can always say, because we don't have data, therefore we can't have a decision. The first vaccines actually rolled out after phase 3 trial in the Western world, which depended on phase 3 data, and 30,000-40,000 people, only happened end of December, early January. So we are only talking about 4 and 4.5 months of vaccination when more than 1.7 billion doses have been already given. So actually, in many ways, the experiment in the field has already happened. So we can be as careful as we want. We don't give these vaccines to newly born. We don't give these vaccines to children, any one of them. Even for Moderna and for Pfizer, look to be more safe vaccine, we still haven't gone officially below the age of 12. And unless you bring the data on the table, you're not likely to go there. Although I don't want to say this, but I'm sure below 12, once you have the data, there's going to be safe vaccine. As I said, experiment has happened already. Maybe it will take some more time. We don't only 4 months into vaccination. Whatever little I have been able to gather after Sukriti told me that we will have discussion on this, there seems to be no major contraindication right now. And the broad guideline that I see, that the gynecologist and so in other words, many lactating women have been vaccinated. And this number will be in hundreds of thousands. So we haven't unless we, have this discussion 4 months from now and say, oh, now we have the data, so therefore we can go back. These many experiments in the case of COVID-19, we don't know a lot of stuff, but what we know can be based on that. So I would say, as a scientist, so what happens in natural infection? Let's say there is a vaccine-induced immunity versus natural infection. So pregnant women or children are, let's say, getting exposed to virus. Many of us do not know we have virus because nature of the virus is this, that 80% is asymptomatic. You never know you had the virus, but you got the immunity. What is vaccine doing? And I'll just take 30 seconds on this. So vaccine is an artificial way, a certain way to raise your immunity, which you would have got through the natural infection. Unfortunately or fortunately, what happens in vaccine is not just piece of virus. Along with vaccine, there are a whole lot of stuff you have to put in, otherwise vaccines cannot be given. There's a delivery agent, there's an adjuvant, there's a cryopreserver. But we've done, I think we've had about 20 phase 3 trials world over, which means we have had 300,000 people under observation on these vaccines. I'll just take 1 minute. What happened with AstraZeneca and Johnson & Johnson? Don't think it didn't happen with Johnson & Johnson. The vector-driven vaccine, they're all based on adenovirus backbone, all 4 of them. So 4 of them is Sputnik is one, so is Johnson & Johnson, so is COVID-Shield, and there's a Chinese vaccine, which has recently been approved by WHO. So 4 of them have the same backbone. Scientists haven't figured out the connection. There was a rare, I would say rare to rare. The number seems to be 1 in 250,000, 1 in 2,000 have this rare blood clot. Is that a major issue? Looking through one lens, if I have the luxury, yes, it's an issue. Is it not an issue? So I would say that's why the European Union said that we think there is a connection, but the overwhelming advantage of vaccination is so much more that we shouldn't worry about. So COVID shield is now being given. Our country, at least in our country, about 90% of all of us vaccinated, including myself, is COVID shield. So whether it's a pregnant woman problem of adult, problem of children, we don't know. Where Johnson & Johnson, for example, was stopped for 11 days in US. Because for some reason, 6 women, all the below age of 30 to 39, suddenly got this rare disease. And by that time, 5 million people had been vaccinated with Johnson & Johnson. So I would slightly nuance it with this as we go on. Policy makers cannot say and will not say and should not say unless the trials are done. Doing trials on very young babies and on pregnant women, as you can imagine, is not going to be a straightforward issue. It's going to take a lot of time. We will base our judgments, not today, maybe months from now, 2 months from now, 3 months from now, based on what we see in the field. So there's no question a lot of pregnant women have had natural infection. So we will end up looking at data, those women who got natural infection and who got vaccinated, how much was the outcome differences? If there are not major differences, statistically no significant, I think policymakers will finally say, as Piali wants to have the vaccine, I think we should come to that point pretty soon, as far as I see. But remember, we are into the vaccine story only for past 5 months, 4 months. This is an amazing time to have vaccinated 1.8 billion people in the world. So I hope I'm answering the question by saying that personally, the way it's going to go is there is no obvious contra-indication that you should not get vaccine. But I would agree with Dr. Sharia that let us wait for a little bit while. But a lot of people don't have access to gynecologists like I and you can have to Dr. Sharia. Very large number of people have access to nobody. Should they be vaccinated in a very poor country or in Africa, for example? But there's nobody to advise. I think personally, I'll take a call finally. We'll wait for a couple of more months to get some more data. Thank you.
Thank you so much. Sukriti?
Thank you, Dr. Rusha. Ramya, finally coming to you. Given your recent coverage related to the vaccine rollout process in India, and we've been reading your pieces, what do you believe have been the key gaps, and how can this process be made more inclusive?
Hi, Sukriti. Thank you, Dr. Osha, for inviting me. This is a lovely, I'm sure it's been said before, but allow me to say that I love the way you've named it, Unmute. And over this year, or rather 2020 and 2021, what's really important is that we've all been muted to our screens. And if we spoke more with each other, perhaps, then so much of this confusion that we have now might have been cleared up automatically. Yeah. So I think the primary issue with the vaccination, I am from Tamil Nadu, a state that has, by and large, better health parameters compared to a lot of states in the country. Maybe Kerala is better off, certainly. But we are used to a certain bare minimum or in terms of healthcare facilities. And we are used to doing things in a certain way. I think the primary problem with vaccination itself is that it was a top-down approach. It was executed by the center, which, and we had to, because the center was giving the drugs, we had to stick to the rules that were laid down by the center. And frankly, this is, we live in a federal setup, and each state has its own way of doing things best. Tamil Nadu will have its own way of, communicating information about. It has its own ways of doing things. It has its own ways of approaching the people. It has its own ways of awareness building, of communication. Not everything works across the board. So I think the original problem was the lag in communicating how important vaccination was for COVID to the public, which is why there was a huge, in fact, in Tamil Nadu, there is still a lot of vaccine hesitancy. And it's alarming that even after the second wave, where we've seen so many deaths, where we've seen people gasping for life, waiting outside hospitals, that people are still afraid to take the vaccine. And this is people in friends' homes. Of course, my relatives have all been bamboozled into taking the vaccine. I'm not giving them a choice here. But look at the suffering that we've seen in the second wave. In the first wave in 2020, we said this was unprecedented. But since then, we've had a series of unprecedented events. This whole COVID-19 has not stopped being unprecedented. It continues to be unprecedented. And we're coming up with so many crises every day that, that we would have never even thought about. For instance, I also help with a volunteers group, Chennai Cares, in Chennai, basically try to act as a bridge between people who need beds and what are available. And at one point of time, we were, all over the place because there were no beds available. But, small things like there was a scheduled power shutdown in one of the suburbs in Chennai, and people who were using the O2 concentrators there couldn't use them, There was a disruption of power supply. So this is something that we've never, ever even imagined. Maybe the next pandemic, we'll figure these things out. We'll have these down in notes. But what I'm trying to say is that in such circumstances, it was very crucial for the government to convey vaccination is, obviously, it is going to be voluntary. No one's going to force you to do that. But I think the messaging was not right, right from the beginning. That's led to a lot of vaccine hesitancy. Our numbers are among the worst across the world. We have 2 vaccines rolled out pretty fast for all that. I mean, if you look at other developing countries or, other countries that are still struggling to get vaccines as part of the COVAX program. And yet our figures are very low. They are not what we would like it to be. We'll need to, I think the only way forward is to step up on this vaccination. We have to, ensure that people get vaccinated. Like someone was saying, the risk of, vaccinating yourself are far less than the risks that you might have from COVID itself. Even the cloths that were noticed in the acids, there was a study in the Oxford group published a study which said that, COVID itself throws up clots. So you have a high percentage of developing clots, even if you get COVID. So, I mean, it's something that we'll have to send as messages, crucial messaging for the community. And I think one way to do this is for the center to give broad guidelines, yes, because they have a role, they have the ICMR, and they have several other bodies that can advise them. But I think another important thing is to allow states to take charge of messaging. I think they'll do it best. We need brand ambassadors. We need to go at this like how we went at HIV or tuberculosis. And that is the only way we will be successful if we go out on a campaign mode. And I think it's about time we started doing that. Thank you, Sukriti.
Thank you, Ramya. Thank you so much. I am cognizant of time. We are at 5:20. I know we are supposed to close in 10 minutes, but we have 4 more questions and a few comments. So I'll request the panelists to use 2-3 minutes for each question so we can close out in time. Just taking off from where Ramya was, that, we need the correct messaging. Conversation focus 3 is focused on dispelling anxieties and misinformation and addressing crucial questions. So I'm going to just ask Dr. Usha to start us off on this one. And Dr. Usha, over to you.
So my question now is to Dr. Hema Divakar. So Foxy recently released a report stating that women should be counseled and empowered to make their own decision, supported, of course, by caregivers without any discrimination between women who accept or refuse the vaccine, as and when it is possible to administer it in our country. And I know this has been, touched by other speakers, but would like to have Hema's view on this. Hema?
Okay, thanks, Usha. I think this entire thing about vaccination, data, evidence is like a chicken and egg kind of a situation, because we don't have the data and we're not sure what to do. And what the Foxy statement actually said was that in other parts of the world, they have recommended truth pregnancy. So we should also offer it over here. But our government has not yet, sent in a regulatory policy brief towards that. Only recently, the lactating women have been recruited onto that. So you have to say that, yes, it is, it's in the pipeline. Maybe someday something will emerge out of, uncertain clarity, the gray zone between them. That is the given. But what the general question about how women's health, non-COVID era also, whatever happened, just let me in 2 minutes bring 3 points. Okay. One is the policymakers should pay attention to the micro details of the implementation, whatever policy that they bring out. That is the key, because the HPV vaccination for young adolescents for cancer cervix is out there last 12 years. There is overwhelming evidence, but we haven't gotten the jab into our girls, that's for sure. Then a simple thing, like 20% of our pregnant women are dying because they are anemic, very, very poorly anemic, and we bought in the injectable iron policy. That also having an overwhelming evidence abroad, they asked for the data within the country, which we did produce. So it's only a question of time. And then when we presented it, the government was kind enough to have the expert opinion, change the policy. And now it's a knee-jerk kind of a reaction. It's a quick fix method for now. But considering that our adolescent girls need to be in the pink of the health before they embark into a pregnancy, yes, that will happen in a decade from now. But in a decade, we'll have 30 million pregnancies every year who may lose their life because of severe anemia. So for them, this policy is really, really good. H1N1. Again, that is a strong recommendation by the Foxy as well as the ministry that, yes, you need to give it to the pregnant women, because the strains also change once every year, but the percentage covered is dismal. So in a short while from now, couple of months, maybe, and even anyway, the procurement of vaccine is a huge hurdle. So when it actually comes, by then, we know that in the country there are several thousands of unintended pregnancies who may well be inadvertently vaccinated. So the gender differentiation and noting of where these vaccinations were given when the women recognized that they had already fallen pregnant, if you follow them up, that itself becomes an observational data. That's one of the crucial things that we can do. So we have to apply our minds on how we get the data on the table, inclusive of people like Priyali, who themselves want to decide. We have given them the choice. So there may be a bunch of women like that who will take the vaccine, and they have to be in our special study group. So when there is a will, there is a way. Otherwise, there will only be excuses. That's what I would like to say. And there are few methodologies thinking out of the box to gather the data. So in a few months to come, I'm sure we will have clarity on the policy as well as the action points for us as clinicians. Thank you.
Thanks, Hema.
Thank you, Dr. Hema. Where there's a will, there's a way. Indira, I'm going to turn to you. I think for far too long, the health system or policies, I'm not too sure whether we keep women at the center of it. And I just want your opinion on that, please. You're on mute, Indira.
Standard problem on Zoom. Thanks, Dr. Chauhan. I'll try and make it as quick as I can. Yes, we do realize that unfortunately, women don't have, there are a lot of access issues when it comes to women accessing healthcare. And a lot of times, health in women is seen only through, purely through a reproductive lens, which doesn't really help, because there are a spectrum of issues that surround problems related to access. We know that, whether over 60, whether under 5, women or, young girls in general don't really have the same kind of access and, as their male counterparts. So we do need to take into consideration when we are designing our policies and our systems to make sure that we are keeping in mind what their challenges are and how we can address them. I mean, take for example, the situation that has arisen in COVID. Women have been impacted in an economic sense. They were already, generally getting paid less, less likely to get the same kind of jobs as their male peers, etc. That has, as studies show, that kind of gap is increasing. We have problems on the domestic front where women have had to give up working, and so now they don't have the opportunity to in financial independence, and therefore even taking care of themselves and their health, because they're looking after so many other people, including their children. Young girls are being forced to drop out of school and sometimes forego their own taking care of themselves in order to help out at home as well. There's a lot of unpaid care. There are mental health issues that are coming into play over here, particularly for women and particularly for those that are facing gender-based violence, domestic abuse, and so on. So we do have to be cognizant as a public health community, as countries and governments, that we keep the needs of women in mind in general, whether it is designing women-focused subsidies or social benefits, for example. Whether you're looking at improving doorstep delivery of care, particularly for women that need to access this care. I mean, there are a lot of times, whether it's reproductive care or others, the burden of stigma, for example, or even mobility is, it's always compounded amongst women. So we have to see how we make it just easier for them to be able to get that kind of care to their doorsteps. We do need to take into consideration that, we need to start when we are opening up. I know we're in a lockdown right now, but we need to plan for ensuring, greater economic opportunity for women and seeing how we can actually design policies at the workspace that allow for women to actually go out there and work and earn, so that they can actually get themselves the kind of healthcare they need and take care of their families, their children's nutrition and so on. And finally, of course, for those that particularly are vulnerable we need to take their mental health needs into account, as well as gender-based violence into account. And we really need to expand the gamut of services, whether it is through partnerships with the private sector or civil society organizations and NGOs, to make sure that women are getting the kind of help and the kind of counseling that they need, and the kind of out that they need when they actually need it. So very complex, but I've tried to just pack it in, and I'm sure there's a lot more out there, and it's far more nuanced than I've been able to state.
The hope is to put them at the center and at the front. So with that, I'm going to turn to Ramya. In the light of rising anxieties, misinformation around COVID-19, I want to understand, how well do you think the media has done in disseminating credible and reliable information? And if not, then what is it that we need to do?
Yeah. I think there's been a bit of both, actually. There's been a lot of good, a lot of information has come through to the public thanks to the media. A lot of information is primarily communicated through the media, through television channels and newspapers, websites also nowadays. So we've done some things right, because, as journalists, also like doctors and researchers, we also place a lot of faith in evidence and in data. And what happens is that this COVID is an evolving condition, and things are constantly evolving around it. We still don't have absolute, watertight treatment protocols. There are so many things we're debating about vaccination, whether it's good, whether it's not. And as things evolve, the science behind it, as the science evolves, we get different kinds of information, as it were. And I think for some journalists, it's a bit of a struggle, frankly, because we are frankly used to saying, yes, do this, because there is this science behind it, there is this evidence behind it. Take this vaccine because this trial said this. But we can't say that anymore. So that puts us in a bit of a dilemma. However, I think the way out, and how we've been managing, is to use whatever is the scientific evidence at that given point of time. And, communicate somehow the fact that this is evolving. It might be different tomorrow. We might say, as the WHO itself said, that remdesivir was good and then it was no longer effective. We might say that. And I think as long as we communicate the fact that this is not static information, but this is evolving, and that we should look at evidence as is currently, I think we would be able to a large measure, counter at least the misrepresentations, myths, and distortions of facts. There's a lot of distortion that's happening, not merely involving alternate streams of medicine, but also within medicine. Everyone's talking about, monoclonal antibodies as if they were learning it from, kindergarten. Everyone's talking about, ECMO, as if they have, lived next to an ECMO all their life. But this kind of, this kind of ease which we have with scientific terminologies is also turning out to be quite a bane, because we have to be careful about what we're talking about, randomly asking for ICU beds and ECMOs, which are clearly medical decisions. So this is something that newspapers should be able to, dissuade people from doing. And like I said, go with the evidence that you have for sure now. Go with recognized bodies like WHO and ICMR, perhaps, maybe FOGSI. Go with research that you read, which is available now online on studies that were done in the US and the UK. I think if journalists stuck to this pattern, we should, I mean, we won't be like, completely comfortable, but because this is, like we said, unprecedented, but we would, be able to at least do an honest job at the end of the day.
Thank you, Ramya. I know we are over time by 3 minutes, but Dr. Rusha, the last question to Shruti and some closing comments by Dr. Chauhan and Dr. Sherrier, and we can close out. Thank you, everybody, for your patience. 5-6 minutes more. Dr. Rusha.
Thank you so much. And thank you, Ramya. And you can add to that lexicon, mucormycosis, IL-6, D-dimer. I mean, people use these things, so casually. And just one thing is, we're talking about vaccinating pregnant women, but I think if we increase vaccination in the non-pregnant people, in the community, overall, COVID will come down. And I think that's another way of actually helping our pregnant women. So coming to Shruti, last question, Shruti, this COVID-19 has been a great challenge, particularly for working women. And sort of how do you feel that the workplace, I mean, whether it's, mental health, physical health, so many things, it's been a challenge. How do you think the workplace, can adapt to this changing environment and going forward? Shruti?
You're on mute, Shruti. Unmute.
So, sorry. So primarily to tackle this, like anything else in life, boundaries and empathy. I think that would take care of the problems. Boundaries from the person working for somebody, make clear boundaries saying, I can't work beyond this time, or this is happening, I'm not able to handle this beyond this time, because I have been collaborating with a few researchers and writers for my next project. And I've had 2-3 of them come to me and say, there's so much bloodshed happening around, I'm not able to focus and write my essay, or I'm just not able to focus. I've been running around helping with other things. This seems so non-important, or I'm so anxious right now, I can't do this work. When in any other circumstance, as somebody who is responsible for a certain project to be delivered, it could be easy for us to say, just put that thought aside and say, hey, go ahead and do your work. But empathy helps, because the fact that somebody has reached out and said they are having mental health issues during this period, and they're saying they are unable to function, you need to be empathetic about that fact. And respect the fact that they have reached out, and see how you can work around it. Constantly check on them if they're doing okay. And it's not, and more than anything, encourage them if they need help. Because if we are all now talking about vaccination and hospitalization, it's all about physical health problems. Why are people still afraid to take help for mental health problem? And especially during this times, it is quite stressful. On the other hand, even as a person who's running my own startup, it is important to make the whole team understand that this is truly a stressful period for all of you. So even if 1 or 2 people are unwell, physically or mentally, it's up to the rest of the team to catch up on work and ensure, because work is also important, because if work doesn't happen, who's going to pay the salaries and support them? It is very important in both ways. More than anything, just make sure that the conversation continues, and respect people's boundaries, and be empathetic towards the situation. That's all I would say.
Thank you, Shruti.
Thank you so much.
Thank you so much. Dr. Rusha, should we turn to Dr. Chauhan for 30 seconds of last comment, and Dr. Sherrier, and we can wrap up? Dr. Chauhan?
Absolutely.
So I'll make 3 bullet points, and I want to end this on good hope. One is, as things are, the world is unfortunately divided into 2 verticals of vaccine world itself. One is the Western world, which has accumulated more vaccine than they need, and the kind of vaccine are also there. That is Moderna, Pfizer, Johnson Johnson. The rest of the world, which is really immunized more than 600 million people, has depended on two other kinds of vaccine made in China or Russia. India is still not a very big player, but India is slated to be very big players. So hopefully by end of the year, there will be supply chains will be much better, not in India, but worldwide. The second bullet point, which I want to share, which is beginning to emerge, fortunately, the virus seems to be under convergent evolution. That is, the new possibility of many, many more mutants, more destructive than the present one, beginning to recede. But I say there's very cautious optimism. The changes we've seen in the viral genome actually happen to be only in 5 or 6 places. So that seems to be good news for the future of these vaccines. The last point is about the which is production of the vaccine. I already said, I think by the end of the year, you would have about 7-8 billions of vaccine by end of this year itself, from China, from India, from elsewhere. The final one, reports that are beginning to come from some labs because the studies are longitudinal. It seems like the vaccine-induced immunity or natural immunity lasts much longer than we earlier thought. We thought that maybe immunity will last 4 or 5 months. Happily, some reports have just come out that the memory responses to this vaccination or natural exposure is much, much longer. So I want to end on that hope that science-wise, we are beginning to look at a scenario that we will be better able to handle the virus spread. Thank you.
Thank you.
Thank you, Dr. Chauhan. And Dr. Sharia, turning to you, I'm so happy people have stayed on and waiting to hear from you the last thoughts before we shut down.
So thank you, Sukriti. Just 4 brief points or messages. Firstly, let's face it, the second wave did become a tsunami, of bad choices, decisions, but at the end of it, I think there is individual responsibility. And I have seen that happening in my practice where people suddenly just lost it, wanted to break out. And in every case where there was an infection, there definitely was some risk taking that happened. So that stay safe, which is the new greeting that we have. Just please keep staying safe for you and for your families. And one way of staying safe is exactly what was said by another panelist. Just vaccinate everyone in your universe, even if you can't be vaccinated. Create your own bubble. You know, our cricketers live in bio bubbles. Create your bio bubble. The second is patience. Please don't lose it. Please keep patience. Just keep your head down and keep going. Winston Churchill said, when going through hell, keep going. We will come out at the other side. Humanity has always come out at the other side. I tell my patients, this is not the time to go to the Maldives or to Goa or to Dubai. And I know it's my patients, maybe a different class, but everyone's been just waiting to do it. The third is messaging, and that's not just for women, it's for social media, it's for the medical profession. We need clear, sensible, evidence-based messaging. Let's face it, social media has made everyone an expert, and messaging has to be honest. Unfortunately, a lot of our messaging is, just doesn't put all the facts forward. And like I quoted UK, UK is going to honestly tell a pregnant woman what her risks are, and then she will make a decision. That's not going to happen in this country. We don't share that kind of information, and we assume our patients won't even understand it. And that's just not fair, because being educated and not educated has nothing to do with being able to understand. And finally, and this just came up a thought to me today, yes, research. There are a number of women out there who are willing to make the choice to take a vaccine. Well, why not tap them for research? And I have a feeling, and this is a gut feel, we've got Dr. Chauhan here, we keep talking about the adenovirus vector. We do have another vaccine in our country. I know we all had concerns, which we have not really paid attention to, which looks pretty good on paper. And maybe, I don't know, maybe that's the one that might be a suitable one. And we need research, fast track research. You already have a number of people who are, biting at this to get out and get tested. And I think we need that testing to happen. But till that testing happens, it would be unfair to shift a scientific and a clinical responsibility onto the woman and saying, you decide whether you want to take the vaccine or not. We don't do it with the other vaccines in pregnancy, right, Hema? We don't say decide whether you want a Tdap. We recommend a Tdap. We recommend the tetravalent influenza vaccine. We don't say you decide. And why is it different here? Why are we playing safe with terminology? Is it safe or isn't it safe? Probably safe is not just good enough.
Thank you, Dr. Sherrier, and it's been an honor to have all of you with us. Dr. Rusha, I'm going to just turn to you to close us out on behalf of Eti and Divas, and from my side, thank you, everybody. I know we have questions, but we've run over time, so I'll get in touch with the panelists and get back. Dr. Rusha, over to you. Muted, unmute.
This has been such an amazing conversation and such valuable insights from everyone. And I think we should just keep having this conversation and dialogue. And probably in another 3 months we should visit this again. And thank you everyone for spending your afternoon. Thank you so much.
Thank you.
Thank you, everybody.
Huge congratulations. Thank you.
Thank you, everyone. Yeah.
Thank you.
Sana